Hi. Last week, President Biden passed the American Rescue Act, and it has to do with the new $1.9 trillion relief that's being received for COVID. The question is, were you aware that there were a number of very, very good and generous health insurance benefits on that plan? My name is Kenneth Wright, and I'm the Health Insurance Savant. Everyone's aware of the COVID relief bill that was passed. We know that there was a big number there, and people in certain businesses know that they've received certain types of benefits, whether you be a concert promoter, whether you be a restaurant. But there's also some very, very generous health insurance benefits for people purchasing health insurance in the private market. And I want to take a moment now to review those for everyone. Probably the benefit that's the most, I would say the most generous, is that anyone that has had even 1 week of unemployment or just been approved for unemployment can receive free marketplace health insurance for the rest of the year. I mean, to me, that is phenomenal. If you filed for unemployment, you don't have to pay for health coverage for the rest of the year, even if you get a job back, even if you go back to work. Of course, if your company offers health coverage, that's another whole issue, but this is an incredible benefit. Another benefit that's being offered is anyone who's lost their job and lost their employment-sponsored coverage often gets an option for something called COBRA. Well, the problem with COBRA for a lot of people is that it's the same premium that the company pays, so that when they get their bill, it's twice to 2.5 times what they were normally paying for their health coverage. Well, again, if you are on COBRA, you will not have to pay a penny for that from April of this year through September. I mean, that's an incredible benefit. Another benefit that's going on is that anybody out there that's within 100 to 400% of the poverty level is going to have an enhanced premium. So what amount is that? Well, that's something you are going to need to go to healthcare.gov for. Matter of fact, I would recommend anybody that has any questions about any of the things I'm talking about, go to healthcare.gov. They have a great 800 number you can reach out to. They're open 24/7. It's a great government service, so go to them. But again, if you were getting some type of subsidy, that subsidy is going to go up. And even better, your total cost for a plan is going to be capped at 8.5% of your income. Some people were paying 20%, 25% of their income for their health coverage. Again, a great benefit under this COVID relief law. And the last one I want to mention is that usually when someone gets a subsidy, if their income overperforms what they estimated at the beginning of the year, they'll have to pay back their subsidy at the end of the year. Well, that's not going to happen for last year or this year. Meaning, if you made more than you thought you were going to make because your income changed a lot, you didn't have your job and you got your job back, and now you're making 10, 15, 20% more than you thought you were going to make, the government is not going to charge you back for the subsidy that you were paid. These are all incredible benefits. Now, these are great benefits for anything in the marketplace, but I also want to make you aware that just because these are marketplace benefits, your best choice or better choice might still be to go with a non-ACA plan. Those prices might not be any different from what you're getting with these subsidies. And especially if you're paying full price in the marketplace, I guarantee you a non-ACA plan is going to be lower and provide better benefits. And for that, you can reach out directly to me. So again, healthcare.gov for anything related to the change in health insurance through the American Rescue Plan Act. Anything else, reach out to me, because I am Kenneth Wright, the Health Insurance Savant. And as everyone always says, why use an agent? You could choose the Savant.